This is for ADVS 5710, Conceptualizing the Human-Animal Bond, Equine Assisted Services Effects on Veterans with PTSD. I chose Equine Assisted Services Effects on Veterans with with Post-Traumatic Stress Disorder. My name is Angel Fiddler. I hold a master's and a bachelor's in health promotion and exercise science. I served in the U.S. Army, active duty, and the Utah Army National Guard. For me, as a veteran, I have, in the recent years, come to understand that I had some issues from my service that involved some emotional closure and reconnection. I have been dealing with mobility issues for several years now. And my involvement with the program here at USU and coming back for a second bachelor's is a part of that reason with that involvement. These pictures show my time as an enlisted soldier on active duty for promotions. The pictures with me and the two gentlemen are my promotion to sergeant from specialist, and this is my graduation picture from my master's. The early history to present shows the beginnings of what we would call post-traumatic stress disorder. In Vietnam, they called this shell shock. Today, after Afghanistan and Iraq, it is more recognizable, and we know that it has lifelong effects on the service members, the veterans, and their families. The definition of post-traumatic stress disorder is exposure to trauma and a stressor after an adverse event with other related symptoms including physical injuries and wounds. These can be seen and unseen. The diagnosis is included in the DSM-4 manual. It has 7 different criteria that must be met and also the exclusions that must be shown. The standard treatments include pharmaceuticals, selective serotonin reuptake inhibitors, such as Zoloft and Paxil, for example, alpha-1 adrenergic antagonists, such as prazosin, which is off-label, and other antidepressants. Mental health treatment options include cognitive processing therapy, prolonged exposure, cognitive behavioral therapy, eye movement desensitization and reprocessing, stress inoculation therapy, individual and group therapy, sport and competition activities, animal-assisted services, including equine-assisted services. Dr. Dave Grossman, a retired lieutenant colonel, says in his book On Combat, pain shared equals pain divided. Joy shared equals joy multiplied. All veterans need a sense of belonging and community. Veteran service organizations such as the VFW, Disabled American Veterans, and the American Legion provide these kind of outlets for our veterans. And a service member with post-traumatic stress disorder can affect their family relationships. It is typically the family who recognizes these subtle shifts initially in that family member. And Wisco et al. Found a veteran with a tight-knit community and stable attachments can help them be more resilient throughout the remainder of their lives and protect against the negative effects of that post-traumatic stress disorder. There's a 60-year history of equine-assisted interventions, which is now equine-assisted services. More recent research has started to begin to create a manual for standard operating procedures for equine assisted activities and therapies. They have found positive results in the quality of life and mental health, though 3 months after these studies, they were not sustained. We know that equine assisted services can be used to help transition a service member and veteran from military life, the combat zone, to civilian life. Horses can be used as a symbology to help them work through those issues, such as obstacles that may be in goals, their relationships, and in the workplace. We need to consider that equine assisted services is more economically feasible with community programming providing the service at the lowest cost and care is performed by the organization versus a service animal in the home, which for a service member who has a service animal, this can be stressful because they have to worry about taking that animal to the vet. They have to make sure they get the food. They have to make sure they get them outside to relieve themselves, or they have to have the litter box cleaned, or there are other issues and costs that may not be they may not be informed of upfront. Whereas with a community programming such as partnering with a university where that cost is smaller, the care is taken care of through the university and they're able to get their veterinary health and their feed taken care of that way. It is much easier and a lower barrier to access with that being there. We also have to be concerned with the service animals' welfare because we know that those who interact with the animals, whether they be the handlers, the trainers, or the clients who are working with them, they can affect the animals. We also know that sometimes people have days where they're off and our animals have days where they're not feeling well either. And so we have to call those sessions. We have to consider that to make sure that we don't place too much stress on our animals. And that's where the 5 freedoms and 5 domains come in. They can be used to periodically assess and measure the well-being of the animals involved in animal assisted services. We also need periodic assessment of volunteers and staff to ensure current training and information, including our volunteer training, staff certification for education updates. In summary, war and post-traumatic stress disorder have affected soldiers in different degrees throughout history, and it affects everyone differently. All of our veterans need a sense of purpose and of community. Horses can help veterans create purpose and community in a safe environment and provide initial improvements in mental health and quality of life. We need more ways to help sustain this improvement beyond that intervention. We need more evidence-based research where universities programs will partner with horses that partner with the Regional Veterans Administration Medical Centers for service members, veterans, and their families. Thank you for listening. Thank you for the opportunity to serve. These are my references. Thank you.